Picture this. A man walks into my office, 74 years old, married for half a century. He looks me dead in the eye and says, "Doc, I feel more alive now than I did at 30. Not physically stronger, not more energetic in the conventional sense, but more alive, more connected, more capable of experiencing genuine pleasure. How is that even possible?" I'm Dr. Charles Bennett, and I've dedicated 3 decades to studying male sexual health in what most people politely call the golden years. And here's what nobody's telling you. The men who struggle most with intimacy after 60 aren't dealing with broken bodies. They're prisoners of outdated information. What if everything you learned about male pleasure was designed for a body you no longer have? What if the very techniques you perfected in your 20s are now actively working against you? When men come to me complaining about declining satisfaction, 90% of doctors will tell them the same thing. It's natural. You're getting older. Lower your expectations. Some will prescribe medication. Others will suggest supplements. A few might recommend therapy. And all of them are missing the point entirely. See, the medical establishment treats this like a hydraulic problem. Not enough blood flow? Here's a pill. Not enough testosterone? Here's a patch. They're trying to turn a 65-year-old body back into a 25-year-old machine. But your body isn't broken. It's been trying to tell you something for years, and you haven't been listening. The real issue? You're using a manual written for someone else. About 6 years ago, I started noticing something peculiar in my patient data. Men who reported the highest levels of satisfaction weren't the ones with the best hormone levels or cardiovascular health. In fact, some of my healthiest patients on paper were the most frustrated. Meanwhile, guys with diabetes, hypertension, even cardiac histories were reporting profound, consistent pleasure. What separated them? I started asking different questions, not about their medical conditions, but about their approach, how they thought about intimacy, how they touched themselves, how much time they allowed, what ran through their minds during private moments. And that's when the pattern emerged. The satisfied men had all made one crucial shift. They'd stopped treating arousal like a sprint and started treating it like a conversation with their own nervous system. But it went deeper than that. I interviewed a patient named Arthur, who'd been married for 52 years. His wife had passed 3 years earlier, and he'd essentially shut down that part of himself. Thought it was over. Done. A chapter closed. Then, during a routine checkup, he casually mentioned he'd started experiencing something unexpected. He described waves of sensation throughout his entire body during ordinary moments, listening to music, taking a hot shower, even sitting in morning sunlight. I thought maybe I was having nerve issues, he said, but it doesn't hurt. It's actually pleasant. I asked him if he'd changed anything about his daily routine. He had. After his wife died, he'd started practicing Tai Chi. Not for sexual reasons, for grief management, stress relief. But the slow, mindful movements had awakened something dormant. His body was remembering how to feel pleasure in stillness rather than urgency. 6 months later, I had 4 more patients report similar experiences. Different backgrounds, different health profiles, but the same discovery. Slowness unlocked sensation. This wasn't coincidence. This was biology I'd somehow missed in 3 decades of practice. Here's what changes everything. Your nervous system at 65 is actually more capable of nuanced pleasure than it was at 25. Let me say that again because it contradicts everything you've been told. Your aging nervous system, the one everyone treats like deteriorating equipment, has developed something your younger self never had: sophisticated discrimination. Think about wine. A 20-year-old tastes wine and registers tastes like grapes, or makes me dizzy. A 60-year-old with a trained palate detects 17 different flavor notes. Oak aging, regional soil characteristics. Your sensory system works the same way. The problem isn't that you've lost capacity. It's that you're still trying to taste with the palate of someone who drinks to get drunk. Younger men experience pleasure as an explosive, all-consuming spike. Intense but brief. Like a firework. Beautiful, but over in seconds. Older men, when they learn how, experience pleasure as layered, complex, sustained waves. Less like fireworks, and more like watching a sunset that lasts an hour. One isn't better than the other. They're completely different phenomena. But we've been trained to believe the firework is the only real version. Want to know something infuriating? Researchers in geriatric sexuality have understood this for over 30 years. There are entire departments in Scandinavian medical universities dedicated to studying pleasure capacity in elderly populations. The data is remarkable. Studies showing that men and women in their 70s and 80s can experience fuller, more satisfying, intimate lives than at any other age, if they're taught to work with their biology instead of against it. But this research rarely makes it into clinical practice. It doesn't get published in mainstream journals. It certainly doesn't get mentioned in routine doctor's appointments. Why? Because there's no profitable pharmaceutical intervention. You can't bottle "slow down and pay attention." You can't patent "explore your whole body" instead of fixating on one part. The medical industry makes billions managing erectile dysfunction. But actual sexual education for aging men? That's not a revenue stream. So doctors stick to prescriptions. And men keep believing something's wrong with them, when the only thing wrong is their instruction manual. Meanwhile, certain men figure it out on their own, usually by accident, sometimes through desperation, and they don't talk about it because our culture still treats male pleasure as something shameful to discuss. This knowledge exists. It's just not distributed. Until now. I want you to try something right now. Don't worry. It's completely appropriate for wherever you're sitting. Close your eyes for a moment. Take 3 deep breaths. Not normal breaths. Deep ones, filling your lungs completely, then releasing slowly. Now, without moving your hand, imagine touching the inside of your wrist with one fingertip. Don't actually do it. Just imagine it clearly. Imagine the temperature, the slight texture of your skin, the pulse point under the surface. Can you feel your awareness shift to that spot? Even though nothing's touching it, there's suddenly sensation there, isn't there? That's your nervous system responding to attention itself. Now imagine dragging that fingertip slowly up your inner forearm, across the inside of your elbow, up the tender skin of your inner bicep. Notice how your body is creating sensation from pure attention. How areas you haven't consciously felt in years suddenly come alive just by directing focus toward them. This is what most men never discover. They believe sensation only happens through friction, pressure, stimulation. But your nervous system is actually designed to respond to intention, to awareness itself. The touch is secondary. The presence is primary. When you bring this same quality of attention to intimate moments, not rushing toward climax, but actually feeling each micro-sensation along the way, everything transforms. You're not trying to force your body to perform. You're listening to what it's already trying to tell you. Let me show you how multiple independent sources confirm this. Clinical neurology. Studies on sensory processing show that neural pathways associated with pleasure actually become more refined with age. The decrease is in speed and intensity, yes, but the increase is in discrimination and sustainability. Your brain literally gets better at extracting nuance from sensation. Cultural anthropology. Indigenous cultures that honor aging, from certain Native American traditions to Taoist sexual practices, have always taught that elder sexuality is about refinement, not performance. It's considered a higher form of intimacy, not a diminished one. My own clinical observations. Over 3,000 patients across 32 years. The pattern holds regardless of medical history, relationship status, or socioeconomic background. Men who embrace slowness, presence, and whole-body awareness report dramatically higher satisfaction than those trying to replicate youthful patterns. Patient testimony. I've collected written accounts from men aged 62 to 91. When given permission to explore beyond conventional techniques, 73% reported discovering pleasure responses they'd never experienced before. Not recovering old capacity, finding new kinds entirely. Evolutionary biology. Male sexuality in youth is optimized for reproduction. Fast, urgent, goal-focused. But humans are one of the few species where males live decades beyond reproductive prime. Why? Because elder sexuality serves different evolutionary purposes: pair bonding, stress relief, immune function, cognitive health. It's designed to work differently because it serves different functions. These aren't opinions. This is convergent evidence from completely separate fields, all pointing to the same truth. Your body isn't failing. You're just using the wrong map. I stumbled onto this almost by accident. 20 years ago, I injured my right hand in a skiing accident. Severe tendon damage. I couldn't grip anything properly for months, and during that time, I was forced to adapt everything in my personal life, including how I approached self-pleasure. I had to use my left hand, different angles, lighter touch because I couldn't generate firm pressure, slower movements because precision was harder. And something unexpected happened. I discovered sensations I'd been completely unaware of. Areas of my body I'd ignored for 40 years suddenly revealed themselves. The experience became less about achieving release and more about exploration. At first, I was frustrated. This wasn't what I was used to. It felt awkward, inefficient. But after a few weeks, I realized something profound. I'd been having more satisfying experiences with an injured hand than I'd had in decades with a functional one. Not because the injury improved anything, but because it forced me out of autopilot. I started researching whether anyone else had documented this. That's when I discovered the Scandinavian studies, the Taoist texts, the buried research. I realized I'd accidentally stumbled into a truth that most men never encounter. Novelty and presence matter more than technique. When my hand healed, I deliberately maintained the new approach, and I started sharing it with patients who seemed open to unconventional guidance. The results were so consistent, so dramatic, that it changed my entire clinical practice. Now I teach this first, before anything else, because it works when nothing else does. Let me explain exactly what's happening in your body. When you're young, your sympathetic nervous system dominates arousal. This is your fight-or-flight system. It's designed for speed, intensity, urgency, rapid heartbeat, shallow breathing, tunnel vision. It's optimized for quick reproductive success. As you age, your parasympathetic nervous system becomes more influential. This is your rest and digest system. Slower heart rate, deeper breathing, expanded awareness. It's designed for sustainability, healing, and complex processing. Here's the crucial part. Parasympathetic arousal creates completely different sensations than sympathetic arousal. Sympathetic pleasure is sharp, concentrated, explosive. It peaks fast and drops off. Parasympathetic pleasure is diffuse, sustained, rolling. It builds gradually, and can maintain for extended periods. Your body is trying to shift from sympathetic to parasympathetic pleasure, but you keep triggering sympathetic patterns, rushing, gripping tightly, holding your breath, fixating on climax. It's like trying to fall asleep while running. Your biology is saying, slow down, and you're responding with, go faster. Tihain. When you finally allow parasympathetic engagement, breathing deeply, relaxing muscles, expanding attention, moving slowly, your nervous system responds immediately. Blood flow becomes more distributed instead of centralized. Sensation spreads across your entire pelvic region, sometimes your whole torso. Your skin becomes more sensitive. Temperature changes register more vividly. Even your hearing becomes part of the experience. This is what researchers call full-body orgasmic response. It's not metaphorical. It's measurable neurological activity. But you can't force it. You can only allow it by stopping the patterns that prevent it. Let me tell you about James. He was 86 when he first came to see me. Prostate cancer survivor, diabetes, heart surgery 2 years prior. On paper, every deck was stacked against him. He'd been celibate for 8 years, not by choice, but by resignation. Figured that chapter was permanently closed. We worked together for about 5 months. I didn't give him medication. I gave him education, taught him about parasympathetic engagement, whole body awareness, extended sessions without goal fixation. At his follow-up, he told me he'd experienced something he described as better than anything in my entire marriage. Not louder, not more intense in the old way, but deeper, more complete. He said he felt it in his chest, his throat, even behind his eyes. I cried afterward, he told me. Not from sadness, from feeling connected to myself again. I'd forgotten that was possible. James, at 86, with multiple health complications, discovered capacities that most healthy 30-year-olds never access. Or consider Vincent, 68. Lifelong anxiety. He'd trained himself to climax in under 2 minutes because any longer triggered panic about taking too long. After working with breathing techniques and reframing, he extended his sessions to 45 minutes, not through force, but through comfort. His anxiety didn't disappear, but it stopped controlling this aspect of his life. He described the difference as the first time I've felt safe in my own body. These aren't exceptional cases. They're what becomes possible when you stop fighting your biology and start working with it. Answer these questions honestly. Nobody's watching. This is just for you. 1. When you engage in self-pleasure, how long do you typically spend? Less than 5 minutes? 5 to 15? Longer? 2. During that time, where does your attention primarily rest? On mental imagery, physical sensation, future goals, elsewhere entirely? 3. Do you breathe deeply and consistently? Or do you hold your breath and breathe shallowly? 4. Can you identify specific sensations in your body right now? Temperature, texture, pressure, without moving or touching anything? 5. When was the last time you deliberately touched a part of your body you don't normally pay attention to during intimate moments? 6. Do you use the same technique, same grip, same rhythm every single time? Has it changed at all in the past decade? 7. How would you describe your typical experience? Satisfying? Mechanical? Rushed? Nourishing? Empty? 8. If you could design the perfect intimate experience without any pressure to perform or achieve, what would it feel like? Not what would happen, but what would it feel like? If you answered under 5 minutes to question 1, you're still operating in survival mode from adolescence. If you couldn't answer question 4, You've lost connection with baseline body awareness. If you haven't changed anything in question 6, you've trained your nervous system into insensitivity through repetition. And if you struggled with question 8, you've been performing someone else's script for so long, you've forgotten your own desires. None of this means you're broken. It means you have specific areas to develop. And development is absolutely possible. Here's what keeps me up at night. If this fundamental truth about male pleasure has been hiding in plain sight for decades, what else have you accepted as unchangeable that's actually just unexamined? What other aspects of your life are you approaching with outdated instructions? How many diminishments have you accepted as just part of aging, when they're actually just part of not adapting? The men who discover what we've talked about today don't stop there. They start questioning everything: their diet, their exercise, their relationships, their purpose. They realize that decline isn't inevitable. It's a choice. Not a conscious choice, but a choice nonetheless. The choice to stop learning, to stop adapting, to stop questioning. You have 2 paths from here. 1, you close this page and continue exactly as you have been. Maybe you feel slightly defensive, slightly uncomfortable with what you've read. Maybe you tell yourself it doesn't apply to you, and nothing changes. 2, you let curiosity override discomfort. You try one thing differently, just one. Maybe you spend 10 minutes instead of 3. Maybe you explore somewhere you've ignored. Maybe you breathe consciously instead of holding your breath. And you notice what happens. I can't make that choice for you. I can only tell you that on the other side of your willingness to experiment lies a version of vitality you've been taught doesn't exist anymore. But it does. It's waiting for the moment you stop performing and start feeling. So what else are you ready to discover about who you actually are, beneath all the stories about who you're supposed to be? That question leads everywhere worth going. And remember, this content is provided for general educational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you have concerns about your sexual health or experience symptoms that worry you, please consult a qualified healthcare provider who can offer personalized guidance based on your individual health status and needs.